Hello, it is nice to see you. Please take a seat. Tell me what's bringing you in today. All right. Okay. You kind of feel like your breast pain switches from one breast to the other. Okay. And how long has that been going on for? Past few months? It's been most noticeable. Have you done like a self-breast exam? You feel like everything's just kind of lumpy? More so? Okay. I will be sure to note that for you there. All right. Any changes as far as medical history? Are you taking any new medications or birth control, specifically hormonal birth control? No. Okay. And then surgical history still the same, no changes? Okay. You don't smoke or drink? And then the family history, we have the maternal grandmother that had breast cancer around the age of 65. No other changes? Okay. I completely understand that you're nervous. Of course, we'll do a very thorough exam on you. Leanna, the PA, she'll sort of explain, what benign breast conditions could be, kind of give her differential diagnosis, of course, do the exam. We have portable imaging here now that we can do for you as well if it's indicated. And she could always go over just, information regarding breast cancer risks, that sort of thing, so that you're kind of more aware and empowered. Absolutely, yeah, no problem. We'll make sure to print off some information on your way out as well. Now, you're not noticing any discharge of the nipple inversion, skin changes, or kind of feel like palpable lumps under the armpit? Okay. So that's a no for all of those, right? Okay. All right. Any sudden changes in appetite or severe weight loss? Okay. The pharmacy is still the same, that's CVS? Okay. Are you actively in pain right now? No? Okay. All right. Let me ask you this. Do you feel like the pain gets worse or that swelling feeling right before your period, and then after your period it tends to go down a little bit as far as the symptoms? It normally resolves. Okay. And that sort of has been happening every month. Gotcha. But more prevalent in the left. Okay. Not a problem at all. Breast concerns are one of the most common reasons people come into the clinic. So don't you worry, you're in great hands. Let me just check you in here. All right. I'm gonna grab your charts. Are you okay if I take your vital signs before you get your exam today? Awesome. Thank you. Do you by any chance know how tall you are? And as far as your weight? All right, perfect. Let me move this a little bit here. If it is okay with you, I'd like to start with blood pressure first. You want to do this arm today? That's totally fine. All right. I'm just going to wrap this around your arm now. Alrighty. quiet for a minute. You have very good blood pressure, 112/72. I'll take this off for you. Sorry for the noise. Right. Are you having any other concerns today aside from the breast changes that you've noted? Good. I love to hear it. I do like our new clinic setup, by the way. I know it's a bit different, but I find that it's a lot more peaceful and a lot easier to see patients in without having to worry about external factors in the environment. And again, just a little bit more peaceful. So definitely let me know in the comments below if you have any input regarding the new medical space that we've sort of made here. So yeah, I know a lot of people, when we first changed up our space, they really missed the computers and the typing versus the writing. So we've now implemented both of them. So 112/72 is the BP. All right. And next up is a temperature check. Any people around you with flu-like symptoms? And you're not having any, right? Good. That is what I like to hear. All right. As you know, this goes right underneath the tongue. No changes there. Yeah, I've been thinking, as you know, outside of the clinic, we do educational videos, whether it's on YouTube, TikTok, Instagram. So I was thinking, once a week we focus on one medical topic that's gynecological or obstetrical, so pregnancy related, GYN related. I'm just going to slip this on. Okay. And through Instagram, we'll have more quizzes and interactive things. TikTok will be a point of view video of what it looks like. And YouTube would just be a super long version of the both of them combined. What do you think? Yes, great idea. I just have to actually stick to what I just said. Agree with you, 100%. All right, your temperature is good. All right, give me 1 second, please. Okay, so what I'm gonna have you do, if you wouldn't mind, is I'm gonna have you get set up on the medical table right behind you. You're just going to, depending on what you're wearing, you could always just lift your shirt up, or if you feel better, you could just take off your bra and cover your chest area with this. We'll expose one area at a time. Lena, the PA, will do her exam, and then moving forward, we'll sort of decide what we want to do, if any imaging or anything like that is warranted. Absolutely, it was my pleasure. It was great seeing you. Let me write the temp here. All right, I'm gonna leave these notes for Leanna, the PA. I'll give this to you, and then I'll give you some privacy, and she'll be in to do your breast exam. Yep, it is absolutely my pleasure. And don't you worry, you're in great hands. Of course, of course. All right, I'll give you some privacy. Hello, it is nice to see you. As you probably already remember, my name is Leanna, and I'm the PA that will be doing your assessment today. Lee, the medical assistant, was just getting done telling me that you've sort of been having, pain in the breasts, typically right before your menstrual cycle comes on, and you've been feeling, some cysts and some lumpiness that have been a concern? Okay, right, yes, and specifically in your left breast, correct? Absolutely, absolutely. We will do our due diligence and make sure that your exam today is very good. Have you noticed any skin changes at all? All right, all right. Well, I'm just gonna grab some gloves here. So we will do a few things for your breast exam today. Some of them are a bit non-conventional because this is an ASMR clinic, so we add a few more features that you wouldn't normally see in your medical OBGYN office. So that is just a disclaimer. So what we're gonna do first is I'm gonna take a pen light to evaluate the skin of both breasts, okay? Absolutely, and of course you let me know if you ever get too uncomfortable here. Just gonna see a light. I'm going to expose this breast first, okay? Absolutely. If you wouldn't mind lifting your arm for a second. No changes, skin changes around the nipple, and no nipple discharge, right? Yes, they appear to be a bit more dense, and that's totally fine and normal. So far, so good. I'm going to cover this breast up here. I'm just going to take a look at your left one. And if you could do the same thing, if you wouldn't mind lifting your arm up. Okay. All right. Light examination is complete. The next thing I'm going to do, if it is okay with you, is sort of do a breast exam now and compare both sides, and you would let me know where in particular has been a concern for you, okay? Absolutely. All right, we're going to start again with the left side. Just going to expose a little bit of area here. A lot of times we sort of treat the breast like a clock. So if you ever wonder on ultrasound or mammogram reports from family members, if they give like an o'clock, that's typically like where it is located if you were to kind of look at the breast as if it was a clock. Right, so if I felt something in this area here, that would be 12 o'clock. This one would be 6 o'clock. Up. I don't note any, concerning cysts at all in that breast. Although, like I said, a bit more dense, so I'll expose the left side here. Painful around this area. Okay. You do have a bit more density in that section. This is what we would call about the 2 to 3 o'clock of your left breast. And it's a little bit more tender. Okay. Yeah, absolutely. We'll definitely take a closer look there. Now, if I were to give my top differential, I would say that still probably related to fibrocystic breasts, but I'm always someone where unless you know 100%, you do the necessary tests, right? Alright. So, with that being said, now on to the more non-conventional parts of the exam that you wouldn't find in your standard real clinic is I'm going to be just doing a sensation test. So what I'm going to do is I'm going to take this very soft cotton swab and you are going to close your eyes and let me know when you feel this as far as which breast you feel that sensation on. Alright, we'll begin. If you could close your eyes. Good. 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 Excellent. Good. Good. Very good. Awesome. Good. You're doing great. Fantastic. You can open your eyes. You did very well with that. All right. So, what I'm going to do for you is we have a new portable ultrasound that connects to my computer here. And so what I'm going to do is some ultrasound imaging so that you don't have to go somewhere else for it. And we're going to confirm that everything we see is indeed benign and nothing that would warrant a biopsy. Yes, absolutely. So what I would like to do though, if it's okay with you, is I'm just going to mark up the area of concern. Good, good, good. All right. So we were looking at the 2 to 3. I'm just going to expose this area here. And this is where we'll do the scan. Just measuring that area. It is a bit tender. All right. No axillary involvement. No nipple discharge, which is good. And it's kind of multiple densities there that are quite mobile, so it's a very good sign. And you do have something similar with the right breast. However, for you, you feel it mostly on the left, right? Understood, understood. Well, the good news is these are all very positive signs pointing to fibrocystic breasts. Let's kind of make a mark here where we're going to put the ultrasound. Put a little bit more here for it to get a good reading. Comes the ultrasound here. I'm just going to add the light. If you want to close your eyes. Very good. All right. So I'm just going to be taking some images here with my laptop. You let me know if you're in discomfort, okay? So let's talk about common risk factors for breast cancer while we're getting you scanned here. So, as far as the risk factors, of course, the most known one is a personal history of breast cancer, early onset of period, alcohol intake, decreased physical activity, and as well as, prolonged use of hormone replacement therapy over 5 years for those who are menopausal. And I'm going to print all that info off for you too. Yes, there could be a familial component to breast cancer as well. Alright, I'll take this off here for you. I'm going to wipe you down here. you covered up. So I am going to have the radiologist also approve and look at those images. But the good news is that everything, as far as what was seen on the scan, from what I can see, is completely benign. Just, some densities noted, but absolutely no suspicious cancerous lesion. Yep. So I don't think you'll be needing a biopsy at all, but I am going to go give your images to the radiologist. I'll have you hang tight here. Again, it was really nice seeing you, and thank you so much for coming in. You're going to hear a lot of, opinions regarding whether or not to recommend self-breast exams. I'm always very much about, a lot of breast self-awareness, being in kind of in tune with the way your breasts normally feel, so that in any instance something changes, you of course come and see me just to be sure. Absolutely. But like I said, let me give you some privacy to get dressed, and the radiologist will be in to read the report. Absolutely. All right. Well, you have a good day, okay? Thank you.